recording this? Yes, okay, great.
Okay, great. Hello, everybody. Thanks for joining. I'm gonna wait 10 seconds just to let the room fill up. I am very happy and looking forward. Okay, great. I'm just going to start talking, jump right in. We have a limited amount of time and a lot of things to say. So as people join, I'm going to start talking a little bit about myself and how I started the journey of GLP-1s. Just to let everyone know, you could always ask questions in the chat box. Towards the end of the webinar, we're going to be answering questions. So please feel free to ask questions. So my name is Bracha Bani, and I'm a family nurse practitioner, and I started IV drips about 8 years ago. A couple years ago, I gained about 15 pounds during COVID. I gained 15 pounds. And at that point, my company just did IV drips. We just did vitamin infusions. We sent IVs to people's homes. During COVID, I gained 15 pounds. It's the first time in my life that I gained weight, and I struggled to lose it. I was working out, eating healthy. I lived a very healthy lifestyle according to how I viewed myself, and I couldn't lose the weight. It was quite frustrating because I was working out all the time and eating healthy, and I just didn't understand how to lose it no matter how hard I tried. And after 2 years, I decided to go on a medication called Ozempic, Semaglutide, and I lost the weight in 3 months. I lost 15 pounds in 3 months. And for the first time ever, I learned about these drugs in a real way, because before that I had a different opinion about them and I didn't understand why our patients kept asking for it. I just thought, why would you need a drug to control what you're eating? Until I experienced it myself. I experienced food noise for the first time in my life, and I experienced the struggle, and I realized that it wasn't so much about my willpower, just my whole body changed. And when I learned about these drugs and when I went on it, I realized they were very, very powerful drugs. And no one's talking about them, how brilliant the drugs actually are. They're not just something to help you lose weight, but they are something that will help increase our lifespan and our health span. And they're revolutionary drugs, what they do to our gut, but also what they do to our brain. And so I created a program to help patients learn how to use these medications, to start listening to their body when you use it correctly, and not silencing your body, because they do have the power to do both. So I created a program to help people listen to their body and not silence it. And I created a program to help people learn how to use these medications as tools, another tool in your toolbox to learn new habits versus a quick fix. And that's why we're here today. So I'm gonna turn the table over to Marianne Cohen, and I am so grateful to have you. I know some people know you and some people don't, so if you could tell us a little bit about yourself, and I'm just grateful to have you here.
Yes, and I'm grateful to be here. So I'm director of the New York Center for Eating Disorders, and I've been a therapist for over 50 years, which is pretty astounding when I hear myself say it. I've had 3 books on the treatment of eating disorders published, and I maintain a private practice on Zoom, and I supervise other professionals. I wanted to share, before we even jumped in, how much judgment I've received from colleagues of mine when I told them or invited them to come to this webinar. They were mistrustful, some skeptical, that what I'm doing is foisting weight loss on all my eating disorder patients. And I want to read an email that a colleague sent me. She said, "I'm hoping there is no role for these injections in the treatment of emotional eating." And it's inappropriate to judge the material that we're going to present before she even hears it. So I want to say to everybody, rather than judgment, let's open ourselves to curiosity. And Bracha talks about curious GLP-1. Are you be curious? So judgment is about a narrowing of your mind, and curiosity is about opening. So before you judge these drugs, listen to what we have to say, and then you'll be in a better place. So I'm involved in learning. I mean, I'm a beginner. Bracha is the Encyclopedia Britannica of all of this. But I'm a beginner, and I'm going to webinars myself, and I just want to show you a couple of things that, so there's this new book out called The Ozempic Revolution that I've read, and I wanted to show you Time Magazine had a special edition. Now, I wish, and we'll talk about this later, I wish they hadn't just said weight loss drugs, because these drugs are so much more than that, but it's about everything we're going to talk about tonight. And Psychology Today had a fabulously interesting article on, could weight loss drugs be a tool, a psychiatric tool? And it was incredibly interesting. So again, curiosity. Now, I realize that we are two different groups here tonight. One are people who don't know about this and want to find out how they work. And so we're going to refer to them as GLP-1 agonists, which is a generic, and semaglutide, which is a generic, and trazepatide, which I can't pronounce, but you will. Yeah, which is a generic. So we'll be talking about these words throughout. So we're two different groups. One who come here who's to learn and to find out what this is all about, and other people who may be on the medications or are thinking about coming on the medications. And we're going to be talking about how to harness psychological dimension to really fortify and make more solid your experience. So what I have learned, can I keep on keeping on?
Yeah. I want
Yeah.
I want to ask one particular question that I'm gonna. It's probably what you're going to answer right now, but this is so revolutionary, and it's not. I would say that the world is shifting over the past few years. I've been talking about this for a couple of years, but the world has shifted in the past 3 years from now having a more now that people are more curious. Before, 3 years ago when I talked to people about this drug, it was a no or what is this? Now it's curious education. And so still what you're doing, even though people are more curious, it's still revolutionary for someone who specializes in emotional eating and eating disorders. Even people who specialize in nutrition, they're still not open to talking about these drugs. Now, you are not only open to talking about it, but you also have put some of your patients on it. Like, that's how we got connected. So how did you get involved, and what made you decide to be so revolutionary and say, you know what, understand how these drugs work and say, I actually could use it to help my patients? Because that's pretty cool.
Well, I didn't think I was being revolutionary. I'll tell you, it came from a place of desperation. And I'll tell you why. So, because what I've learned has been astonishing. And I just want to take 1 minute before I jump into how I got involved, which is this. The Department of Veteran Affairs reviewed 2.5 million patient records. They analyzed those that have been on GLP-1s, and they found an incredible benefit. 2.5 million patients, that's not 10. And they discovered that they help prevent and treat Alzheimer's, smoking, alcohol, drug addiction, improve blood clotting, help fight infections, kidney, liver, heart attacks, strokes, even sleep apnea was improved 63%, and they turn down the food noise in your brain so you naturally eat less. So I wanted to talk about my desperation, which led me here, and it wasn't revolutionary. And I'm going to call this a miracle. I have a patient, I'll call her Sharon. She's given me permission to talk about her case. Before she came to see me, Sharon really struggled with bulimia, binging, and purging, had been in multiple hospitals, seen multiple therapists, multiple medications, multiple doctors. She would get better for a little while and then fall off the wagon. So we've been working together, and she went into a relapse, and the relapse involved throwing up 10 times a day. And I was desperate because she's been to every hospital on the Eastern Seaboard. She's been to, I don't have to go over, but everything.
Wow.
And she asked me if I could help her connect with semaglutide. She had a feeling. And I was skeptical. I mean, if nothing else is going to work, why is this going to work? And that's when I reached out to Bracha. And this is the miracle. 12 hours after she began her first injection, Sharon was not binging or purging.
I like cry every time you tell me this story.
No,
It's
me
so,
too.
yeah.
I really felt that this girl could die. And I was feeling scared. And when she said 12 hours later, I mean, it was almost to the minute, it was startling.
Yeah.
So she was relieved and delighted, and I was relieved and delighted. But that's not the whole story. We're going to talk about more when we get to the psychological dimension of helping people.
Yeah.
But yeah,
That's
so go ahead.
amazing story. And just I'll just add in a quick understanding of what's happening on a like a medicine or a scientific
Yeah, yeah.
level. There's still a lot of things that we don't fully understand of how this drug works in our brain, but one thing that we understand and how it's the same reason why it helps with food and sugar, but what the drug does, it I like to call it the pause factor, and what we know logically and we know what we know emotionally usually are combined. So when we do something like let's say eat sugar, or whether it's alcohol, smoking, or even purging, at that moment, that split second, we truly believe it's going to make us feel good. And what we know logically, we know the emotion is like it's attached. It's like doesn't separate, and it's really hard to make those good decisions or the decision that we want to make logically. It's almost like the emotion has more of the control. What GLP-1s do, semaglutide, Mounjaro, tirzepatide, is they actually separate. It's called a pause factor or delayed instant gratification. And you're going to see this become more and more popular, and you're going to see it more in the news. But this is what we realized 3 years ago, that our patients were having this pause factor, which it's delayed instant gratification. So what I feel logically and what I feel emotionally now become two separate thoughts, which allow me then to make different decisions, which is how we use it as a tool. So it's super cool. So once you tap into this, you're on the right dose and you're working with the right provider, and then you're able to identify when it happens in your brain that you say, I know that I feel like I want to do this, but now I actually know I don't need that extra snack, or purging might not be the best idea for me. And it's not actually going to make me feel better. It's just like a habit, or it's just this emotional thing that I'm feeling. And I could take a walk instead, or I could discuss my feelings, but it allows you to have the ability to do that. So it's kind of like, drugs that people use, let's say for depression. It also allows people to make different decisions. That's why we're looking at it now as becoming, is it a drug for psychology that we're going to be able to use? So on the scientific level, in a very vague understanding of why this drug works for people who are emotional eaters, is because of that split. because of that pause, because of that delayed instant gratification. So now back to you, what is emotional eating? Can you give us examples of it?
Yeah. I want to ask you a question.
Yeah.
Given that Sharon had tried a million different medications that never worked, do you think the semaglutide actually, in addition to what you said about the pause factor, is that chemical somehow what we're missing in our brains if people are emotional eaters?
I think I don't really know exactly what's causing it. Like we
Right.
don't, on a scientific level, I don't think we could still explain it, but I think there's some sort of delayed instant gratification that we have. Our hypothalamus is responsible for it, and there's like a delayed instant gratification. Now, could you master that skill? Basically, I think that's what you're at. Could someone, could people master it? And I believe that we could. And that's kind of what we train our patients to do. What we do is we help them out a bit. So we say, okay, we're splitting that thought for you so that you have the ability to make different decisions. But what happens after 6 months or after 1 year of us helping you out? Now, can we pull the drug away and you continue to make those decisions because now that became your lifestyle? And there are a lot of patients that we see success with that because, and that's the same type of thing we do with, let's say, someone who is on a medication for depression or anxiety. Doesn't necessarily mean they stay on that for life. It could be that they're able to learn how to cope with it and develop skills so that they can do it themselves. There are certain people that stay on it, but I think there's room to learn the skills. And it's really difficult to do it at certain points in your life when you have no help, nor should you try to do it alone. I mean, it's like telling someone who's depressed, just try a little harder to be happy. That's what I feel like. It's the same thing when you talk to people about whether it's purging or, emotional eating or weight loss, trying a little harder is not really a very empathetic answer or understanding the condition too much. Everyone is trying hard. It's getting the right help you need to get there. So I think it's basically something that allows people to listen to their body, which we are not very good at this generation. But I think that eventually we can learn the skills to be good at it. Yeah,
Okay.
that's what
So emotional eating is people who are emotional eaters are hungry from their heart, not from their stomach. They turn to food as a coping mechanism to cope with feelings that are too difficult to digest. Feelings of depression, anxiety, grief. I see grief a lot. Sexual confusion, trauma, emotions that have not yet been explored enough to be metabolized psychologically into the person. So they turn to food. Food, after all, is the cheapest, most legal, socially sanctioned, available, mood-altering drug on the market.
yeah,
So unlike drugs, unlike alcohol, food is available, food is easy. And emotional eating is when you are lonely in the middle of the night and you look for comfort in the refrigerator. Or emotional eating is when you're angry and you want to bite someone's head off, and instead you go and you bite food. Or emotional eating is when you're bored and you don't know what to do. So you binge and purge to keep yourself company. So what's interesting about eating disorders is that they're about food, but they're not about food. They're
yeah,
about the behavior of food, the symptom of food, but they're also about the coping mechanism to help people get through difficult emotional stuff. There's a lot of stuff. So
yeah,
food helps you deny, distract, detour all your difficult feelings.
yeah. An interesting study that I read in a book. It's called The Magic Pill. It's about a journalist talking about Ozempic. He did a 1-year journey on it. And there was a study with people who get the gastric sleeve. They have a very high percentage of having addictions after. You would think, what does the gastric sleeve surgery have anything to do with addictions? It's kind of an interesting correlation. And he said that most people who have the gastric sleeve, they physically, and during that journey, they physically can't eat anymore, yet they don't know how to process their emotions. So they end up turning to other things to process their emotions instead of dealing with it. So whether it's alcohol, gambling, smoking, sex, it ends up turning into a different sort of addiction, which is very interesting. I mean, so you speak to surgeons who do gastric sleeve surgery, they do know about this study because it happens so often. And the interesting thing is, you may say, oh, well, then wouldn't GLP-1s or semaglutide, Ozempic, wouldn't they also do that? The difference is that what I spoke about earlier, they're not just fixing your gut, they're also doing something in your brain, which makes them so cool, which is really why I believe that they're revolutionary, is because they cause that pause factor in your brain, which allows you to make different decisions. So it's helping with your brain as well. And when you team up with with the medical provider, therapist, someone who's helping you with emotional eating, then you're able to really get the team that you need to be on the right journey. So I thought that was interesting. So what does it mean if someone's harnessing psychology for someone to have success with semaglutide? How do we navigate through that? So people are going on these medications, and how do they combine everything together?
That is the key that I want to talk about tonight. That is my key point. Because if you're an emotional eater and you've used food to cope with difficult feelings, what are you going to do? If your wish to eat, your cravings to eat are dialed down and food doesn't feel like an option, what are you going to do? So what if you are like my patient, Janet? Janet had a binge eating disorder and had a relapse after the birth of her 4th child. She went on semaglutide and she lost weight and she was delighted. But it didn't help with the emotion of anger and loneliness that her husband was not helping her with this 4th baby. She was overwhelmed at the amount of work and very angry at him. So the injection helped with the behavior of her eating, but it didn't help with what was sending her to the refrigerator.
Correct.
All the injections in the world, all the weight loss in the world is not going to resolve a problem that has an emotional root. So this is my key point, that if you are an emotional eater, and not everyone is an emotional eater, the people who come to me in my practice are emotional eaters, we can, bracha and IV drips can help you with the symptom of overeating, but not with the internal
Correct.
emotional struggle.
Correct.
And here's the thing, unresolved anger and unresolved sadness doesn't get better. What it does is it sends people back eventually to the comfort of food, and they're looking for love in all the wrong places, which is what I call it.
Yeah.
Let's say, here's another example. Let's say you're my patient, Melanie. So Melanie wants to get married, like all of her girlfriends are married. And she believes that losing weight is going to make her, quote unquote, more marriage eligible. So after losing weight on semaglutide injections, Melanie got depressed, which was not the reaction she was expecting. She thought she would be elated. She did feel better about herself. She did feel prettier. But what happened is she began talking in therapy about how her parents, according to her, had the worst marriage in the history of civilization, and that she was really afraid of making a connection with a man. She was really afraid of putting herself out in a relationship, and maybe she kept the weight on as a protection. Certainly, we know a lot of people, those who have been sexually abused, often have extra protection. I was on a television show. I wasn't planning to mention this. I was on a television show years ago, and the topic, it's a terrible name for the topic. It was called, forgive me, Too Fat to Be Raped Again. And I was the professional speaker. And it was about people who kept the weight on because they were frightened of the
Yeah.
vulnerability of the assault that they hadn't processed yet.
Yeah.
So Melanie, fortunately, she was able to bring the fear about what a relationship would feel like and how she didn't want to repeat her parents' marriage. But fortunately, she was able to bring this anxiety out to the light of day so that in her therapy, she could unravel it, she could talk about it, and she could move towards some resolution.
Yeah.
So here again, the injections helped her lose weight. But it was only when she was able to get to the root of what was really tying her up in knots that she was able to forge ahead.
Yeah.
Yeah.
It's a great example. It's a great example. And it's like it doesn't fix everything, right? It's like it's a process. And I like always like to compare it to going on a medication for depression. It doesn't fix everything. It
Right.
just like helps you learn how to navigate through it. You still have to deal with why are you feeling lonely or empty or sad? Why are you feeling that way? The medications are not going to give you the answers. You still have to go through the process to figure that out. It's the same type of thing with these medications. They're not it's not the injection, and even for the weight loss, it's not the injection alone, I think, and I'm a big fan of this injection. I think people put it on a too much of a pedestal in terms of what it's actually gonna do for you. It's just a tool. Why I find it so fascinating is because it's a tool that if you really have the desire to get better, it's a tool that really works. The same type of thing with weight loss. It's the actions that you change while you're on these drugs to help you lose weight, for it to give you really long-term success. It's the person you become on these medications, that help you have long-term success. And I tell my patients all the time, if you're the same person when you went on it and you're the same person when you went off of it, then we did nothing besides give you a drug. Like if you're the same person and your habits didn't change and nothing about you changed and the way you think didn't change, then yes, then you just got a prescription. And that's like we push against that so much. And it's forcing people to change like who they are inside. These medications help you do that. And you know, for your example with your patient Melanie, she still had to deal with everything that she needed to deal with, but at least her brain was not being clogged up by the fridge. At least there's one step closer where you realize I don't have to think about food all day. I actually could think about why I'm doing this now. So it definitely helps. It helps people pause, make them do different decisions, and also it allows you to think about the things that you really need to think about instead of food is constantly being on the front of your mind. And so you're not really thinking about why I'm thinking about food all day. And so it's helping you get there faster. It's a pretty cool drug. So thank you for that. And as I said, it's like it works in our brain, it works in our gut. And it's so important when you go on this journey to have the right medical team. Going to oncologist for a GI problem or a podiatrist for dermatology, like that's really when you go to a doctor who doesn't understand this medication. It's art and science together. It's a beautiful drug. But if you go to the wrong doctor, that they're just prescribing it for weight loss or through a med spa, or they're not like teaming you up with the proper people, then it's literally going to the wrong doctor for the wrong thing. I mean, this drug could be used for so many different things, and it's so important to use it correctly. So, now,
And you've made the point that a professional needs to be adept in knowing how to titrate the doses
it's all about dosing.
because what works for this one may not work for that one. So you can't be on the same amount as your friend or your cousin or your
Yeah,
mother. So it's
correct.
individualized.
It's so individualized. And I'll just say this real quick. One, it's certain times people are like, I'm not losing weight. They're frustrated, and we talk about what they're eating. We actually lower their dose. So it's how to make sure that you're eating the right amount of calories. It's not about eating less, it's about eating right. And also sometimes we put people on it that we don't necessarily want them to lose weight, but we want to control their inflammation. So we put people on who have Crohn's or IBS. I don't want to put them on a high dose because I don't want them to lose weight, and nor do they want to lose weight, but we also want to control their inflammation. This drug also helps with inflammatory markers. So, or sometimes we'll put people on it who, are older. I have a couple of patients in their 70s or 80s that want to lose a couple pounds, but they also don't have a big appetite. So they're not a candidate to go up high. We have to find the right dose. And then there are certain people who it's not necessarily that they want to lose weight, but they're always obsessing over food, always going to the cabinet, don't know how to break habits. And they, whether they're binging or purging, they food obsessed, and it's taking over their mind. And so then with the right team, with the right therapist, with the right eating disorder specialist, and with the right provider, we're able to find the correct dose for them, that we're just targeting more of their brain than their gut. And when we dose patients, we ask them multiple different questions. And it's not just, we don't even, it's not even, are you losing weight? Our questions are more like, how hungry are you feeling? How are you feeling satiated? What's your food noise like? What's the pause factor in your head? How many times did you make the right decision? We actually look at actions. What were the actions that you made this week based off of how the drug's working in your brain? And we look about what's happening in someone's brain while they're on their drug, while they're on this drug. So there's so many things to understand how to use this drug outside of going up on the dose, because it's 4 weeks later. And it's such a problem. I would say the biggest problem with this drug is providers prescribing it wrong, or patients really pushing providers to give it to them when it's not really their specialty. And all of the negative things that we see, and the side effects that you see is, I would say, like high up to at least over 80%. When people tell me about side effects, I say, who prescribed it to you? How much were you coached on it? And like 100% of those times, they didn't have a specialty in understanding this drug or understand how to use it. Because if someone does and they have a specialty in it, you don't get those sort of side effects. So, and this is probably a good question to ask you, like, why do you think so many therapists are skeptical about taking these medications or even trying it? We are starting to see things in the news about it. So why do you think that why do you think people are so skeptical about it? And what's your viewpoint on it? Do you think it's
Yeah,
going
yeah,
to
yeah.
shed some light soon, or?
Well, first of all, can I just ask you, do you think it's a dirty thing to say that maybe some people will have to be on this for life? I mean,
Uh,
is it,
yeah, there are
would,
definitely going to be people on it for
is
like,
it okay to say that? Because I know that you've made the point over and over again that it's a tool and people have to learn the skills of living and managing emotions. Um, but there have to be a group of people who would probably have to be on it. This would be one factor that would turn therapists off. Oh my God, forever. In the meantime, many patients are on antidepressants forever, certainly on high blood pressure medication forever. Um,
yeah. I think a lot of people will be on it forever, and that's okay. It depends on what you're prescribing it for. So, I have patients who had some struggle in their life. They want to lose like 15 pounds. We put them on it. Like my story, I went on it to lose 15 pounds. I microdose on it today because I'm a believer in the drug. I think it's going to help me live longer. This is not about emotional eating, but this is more the reason why I like it is because I like it for many reasons. I also like it for the emotional eating part, but the reason why I'm on it, and the reason why I talk about microdosing on another topic, but when you if you want to live longer and if you want to slow down your aging process, which is like what our company's, one of the things that we do, one of our buckets, is you have to lower your glucose spikes. Lowering glucose spikes is really the future for anti-aging, besides sleeping well and brain health and eating properly, but lowering glucose spikes. And these medications lower your sugar spikes. And so essentially and they have a certain pathway that they decrease inflammation in your body. And so essentially, I don't know if people have heard of people taking metformin to live longer as an anti-aging supplement. And so GLP-1s are just like 10 times better than metformin. So they're, I believe, truly believe they're actually going to be something that most people will be on one day for anti-aging reasons. Maybe it's not going to be called semaglutide or not going to be called Ozempic, but in the next 5 years, they're going to be drugs that are similar. They're going to be doing a similar thing to what these medications are doing, and they're going to just be on it just on low doses. It's going to be microdose. It's not going to give the effect of lowering your appetite, maybe a little bit, but not really. And it's just going to lower sugar spikes. And it's a brilliant drug because it's going to help people live longer, and hopefully it'll be at a very low people who have struggled with obesity their entire life, or even just to control their thoughts. I mean, we have people on it for OCD reasons, and they're like, I'm never getting off this because it makes my life better. And part about it is that it's a drug that actually helps you live longer. So how awesome is that?
So Bracha, you're fading out. You're fading out as you said you might.
That will help you.
Okay.
Did I lose a little bit of?
Yeah, you did, but you're back. I think you're back now.
Sorry.
Are you there? So shall we call it
Back on.
Ponce de Leon Fountain of Youth?
So
Call it Ponce de Leon's Fountain of Youth.
So that's
okay.
Yeah.
So I'll continue to talk until you can reconnect.
Yeah.
Okay. I wanted to talk, go back to talk about Sharon, for whom this was a miracle drug, because even though she was relieved and delighted, and I was relieved and delighted, there's a but here. And the but is that I think her relapse was caused by a great deal of fear and anxiety about the impending death of her mother. And when you are throwing up, there's nothing else on your mind except how can I get enough food in me to purge it? And in a way, it's an elegant solution to emotional pain. And I think that her need to be able to have the courage to feel, and that's an expression I'm liking a lot for these patients, the courage to feel, not just the courage to take an injection, but the courage to feel whatever is going on emotionally for you is really a very key component. And I was thinking the courage in therapy to talk over and over again about the fear and the anxiety of her mother's death. And I say over and over again because bulimia is over and over again. Bulimia has a rhythmic thing of binge and purge and binge and purge and binge and purge, but you can't get it out of your system. You can't resolve it. But with words that are attached to feelings, working with the therapist, it can really help somebody come to a place of peace. No. Maybe acceptance, maybe grief. Because I think, as I said before, I think grief is a very big factor underlying emotional eating. And grief freezes our feelings. And talking through something in therapy can make feelings come alive in order to get resolved.
Yeah.
Yeah. So, yeah. Now, I think that what therapists need to do and what patients need to ask themselves is if the semaglutide injections are going to help me and they're going to help me lose weight and maybe feel better about myself, what's the next emotional issue that maybe I've been pushing to the back burner, that I've been using the food and now
Yeah.
the injections to cover up? So one girl said to me when I said, so what's the next issue now that you're on these injections, you're losing weight? She said to me, divorcing my husband, but I'm really afraid. I said, okay, but you're acknowledging it. Doesn't mean you have to do it. You're acknowledging a feeling that was underlying what was sending you to the food. Or
Yeah.
someone else said to me, this was so poignant. She said, I'm going to have to face the sexual abuse that my grandfather did to me, and I would rather eat.
Yeah. Wow.
Yeah. So if we begin, we always say in our profession to begin where the patient is at, then that's where we begin. She doesn't want to stop eating. And we have to honor that. Even though she wanted to lose weight, she didn't want to stop eating. She didn't want to feel the pain. And who could blame her? So to have a comprehensive psychological strategy for yourself
Yeah.
is to blend together the help of these medications with the psychological dimension that may go into fueling your
Yeah.
emotional eating.
Yeah.
So here's why I think more about why I think therapists are against it. Or, first of all, as you said so poignant, so eloquently at the beginning, these are revolutionary. Not a lot of us have a lot of information about it. You do because you've studied this and studied it, and you're a healthcare provider and you're a nurse practitioner. Most of it are newbies, and we're
Yeah.
just learning about it.
Yeah.
So therapists believe, I don't, most therapists believe if you work out the emotional aspect of your eating problem, you'll get better. I've never believed that. I believe that your biochemistry, your behaviors has to be involved. It's not just working out your emotional issues.
Yeah.
So a lot of therapists believe that that's the true path to healing. I think it's far more complicated than that. I think a lot of therapists see this as a quick fix,
Yeah. Yep. Oh,
which
a lot of
that
people do.
is
Yeah.
not.
It's
So,
not.
um, so many people do believe that weight loss is the medicine that's going to heal everything in their life, from a mother dying to a husband's neglect and helping care for 4 children. So weight loss is not a medicine that will cure your whole life issues. It's one aspect, a physical aspect.
Yeah.
So that's why I'm here to say combining that physical support with the emotional support is really what's going to help somebody come to peace with these issues.
Yeah. Yeah.
So the GLP-1 journey is both psychological and physical.
Correct.
Right.
Correct. We're gonna answer some questions. I see that people are asking about different questions we're gonna get to in 1 minute. I want to talk about and please continue to ask questions. We're gonna answer as many of them as possible. I want to talk about the shame. Um, And just wanted to hear your perspective on that. I mean, there's just in general, there's a lot of body shame.
Yeah. Oh, and that's another reason why therapists are against this. We've worked so hard to break through toxic diet culture. Toxic diet culture says women are only lovable if they're thin. And we've worked so hard to expand the narrative of that all bodies are valid and valuable. And that's why these medications are not just, you should lose weight so you can look like what the media says we should look like. So I think that's another reason that people have worked so hard to conquer the belief calories in equals calories out, diets don't work. All of these old beliefs that have really tied people in knots, because what you eat and what you don't eat doesn't necessarily lead to weight loss. I mean, your story is a beautiful example.
Thank you.
So I think therapists feel that you know, well, just what I said, that there is a belief that you have to do the emotional work and only the emotional work, and then that's it. Yeah.
Yeah, it's a combination. It's a combination.
Right.
Uh,
So
and
about shame. So just let me say about shame. So we've tried so hard to dismantle toxic diet culture that we have to make sure that the narrative about these injections is not just about weight loss. It's about health. It's about slowing down the impulsive reach for the food, the compulsive behaviors. It's not just about weight loss. That's why the magazine of Time, I didn't appreciate their saying weight loss drugs, because it's much more than that.
yeah, so much more, so much more. Um, and you know, one thing I read in a book, The Magic Pill, it was a great book. And I recommend everyone to read it. And again, it was about this journalist who studied Ozempic for 1 year. And you know, he said how many people just can't even look at can't even look at themselves naked in the mirror, which is like something nobody wants to talk about. But that shouldn't be. Like, we shouldn't feel uncomfortable to look at our body, you know, naked in the mirror. And there's a lot of shame around that. And I think it's, as you said, like, it's not one size fits all. It's not like it's not just working through it, then all of a sudden all of their behaviors are going to change, you know? I mean, it's difficult. It's difficult for someone who even doesn't have an emotional eating disorder to lose weight. I mean, people struggle from weight loss just based off of the chemistry and how food is wired in our brain. I mean, there's another whole world that also struggles with weight loss, that it's not necessarily stemming from an emotional eating part, but it's also stemming from American diet, which is another topic for a different conversation, where it's
Right.
scientifically engineered for you to want more.
Right.
And so there's a lot of different multifaceteds, and that could lead to other emotional things. So I think it's complicated. So I want to just take some time and answer some questions that people are asking. And
I want to just tell you a quote that I wrote down that I thought it was really great. You know, once upon a time, Oprah, who we know her weight loss journey has really been
yeah,
all the media. So I have this great quote.
and that's nice that she made it public.
Yeah. So I can't find the quote right now, but what she said initially is, anyone who's on these injections is taking the easy way out.
Yeah,
Then she went on it and she said, this is a gift. This is a redemption. This is me claiming my body,
Yeah.
and I'm no longer going to be subject to our culture's shame or my own shame.
Yeah.
So in these two quotes, she really shared something about her journey.
Yeah. Yeah. And that was, really nice of her to share that because I think it helped a lot of people. And again, I want to say that it's almost just like, again, for someone prescribing medications for depression, we're not going to tell someone to try harder to be happy. And it's just a leverage. It's just another tool in the toolbox. Um, I'm using an example, like it's a real estate example, but if someone was buying a building, most people don't put fully cash. They take money from the bank, they put a little bit of their own money in, and then they take money from the bank and they use that bank's money as leverage. And then they take that money and then they buy like many buildings, right? If you're just using all of your money 100%, you'd buy one building, maybe two, but you wouldn't be able to buy 20. Nobody says, you know what? You cheated. You took money from the bank. No, it's a system. It's leveraging things that exist nowadays to help you get there. It's like saying, as someone who needs to lose 100 pounds, you cheated. You took the easy way out. You know what? That person got to health quicker. So instead of taking them 5 years to get healthy, it took them 1 year to get healthy, and then those 4 years they weren't unhealthy. Is that cheating? Then that's okay. Like, cheat your way to good health, because that's 4 years less of inflammation and 4 years less of putting yourself at all those health habits, health risk. So I think it's important to understand, like, if there's something out there that will help you get to the place faster that you need to get to, and it's a healthy process, then you should do that. Um, and so uh, I will say that like ChatGPT came out, AI came out, even when the internet came out, it was revolutionary. When the internet came out, there are a lot of people that were like, I'm not going to use the internet. When AI came out, I mean, people are still, there was many people felt very threatened by it, and not a lot of people use, I mean, it's controversial still, but it really there to help make our lives better. So these drugs are revolutionary in terms of how we need to think of it. And with time, over the next couple of years, we'll see more and more people being open to them because they're going to start seeing, oh, it's really helping. It's just change, and it's change. And that's hard for us as humans. Um, so I will just, maybe we'll answer a couple questions. So, someone asked a question here about, she said she read your book, and she has struggled with weight on and off since she was a teenager. She was put on Ozempic and it made her feel sick. I couldn't continue whatever weight I had lost. I just gained it back quickly. My question is it really different than yo-yo dieting? When you stop it, then the weight will come back. So probably the way that you use this drug was a quick fix, and you used it as yo-yo diet. It's the same. The way this person used this medication was pretty similar to what a quick fix is like in yo-yo dieting. I mean, the fact that you feel sick on the medication is never a good sign. Someone's feeling sick on this medication, it's not a good sign. It shows that you're not using it correctly. You're not supposed to feel sick on these drugs when you're using them correctly. She wasn't eating the right thing, or her dose was way too high. But you shouldn't be feeling sick. But I don't know if you want to add anything to that.
What should she have done?
She wasn't being monitored by an appropriate person who understood this drug. You shouldn't feel sick on it. I mean, after 3 days or 4 days, I mean, after 1 week of feeling sick, why'd you take the next injection? You should have gone back to your doctor and said you felt sick on it. If you took the same dose again, then that's a problem. You should have gone lower, or what were you eating? So basically, anytime you go on this drug and you're going to eat something that's going to increase your sugar spikes, you're going to feel sick. I have patients that come to me and they have a very poor diet, and, they're like, this drug's horrible. It makes me feel sick all the time. They tell me what they're eating, and I'm like, it's your body telling you, I don't like what you just ate. So you just had those fries. Yeah, but it just had 5. It doesn't matter. Your body didn't like it. It's talking to you. Listen, if you're feeling sick on these drugs, it's basically, and you continue to eat the wrong foods on it, you just don't want to listen to your body. So then just don't take it if you don't want to listen to your body. You're gonna not feel well when it's real-time feedback. That's Exactly. It's a coach. It's a coach. Look at this drug as a coach. If you're on the right dose, the coach, it talks to you. If you're dosed correctly, it's talking to you. So either you're eating things that spike your sugar. And also, again, for example, just a small example to explain to people like how it's important to have someone who understands this drug. If you drink coffee or caffeine, it spikes your sugar. You could not eat anything and then you have coffee, black coffee, spikes your sugar, you're going to feel sick on it. And then you're like, this drug's making me feel sick. No, you didn't understand a proper nutrition when you went on these medications. Again, it's like an oncologist treating for a dermatologist problem. So you're using the drug incorrectly. You have to go to someone who's done this again and again and again and again and again and again. So that's my answer. Now, if you, again, did not change as a person when you went off of it, then yes, you're going to gain the weight back. So that's like what I would say. Another question someone said here is, there's anecdotal evidence of success with real side effects, lack of long-term studies beyond 3 years, weight loss with someone. Okay, so people going on this for emotional eating or any sort of like emotional disorder eating. So they're saying, how do you, there's not a lot of studies on it. So one, I will say in terms of just in general, these medications have been around since 2009. The first GLP-1, which is called an integrin hormone, was in for Byetta. That was the first medication. So it's been around for a very long time. We have a lot of studies on it. Do we have a lot of studies about using it for eating disorders? No, we don't. What we're doing is revolutionary. I think we're going to see more and more studies. There has to be someone who's going to try it first. And so you're looking at the two people who are willing to do things that not a lot of people are willing to do because we strongly believe it's going to help people. And not a lot of physicians or practitioners are going to take those sort of risks. But I think that there's change that happens in the world with people who are willing to take risks for a fundamental belief. And so that's why I'm here today. And that's why Marianne Cohen's here today. And we're seeing success. And so we're going to keep talking about it and keep on trying to help people because we're continuing to see success. And if you want to go on this, whether you use our program or a different program, you should do it with someone who's done it before, who's seen success with this. So you'd be taking a very big risk by going to someone who has no idea what they're doing with the GLP-1. So it starts somewhere, and I'm fascinated by these drugs, and yeah, I'm honored, and I appreciate that Marianne Cohen has been, open to trying it, and we're saving lives, and I'm very proud of that. I'm very proud of that. So next question, do you want to add anything, Marianne Cohen?
No,
Okay.
bro, you're the encyclopedia.
My general practitioner prescribed this to me, and I was surprised to hear how important dosage is. Are there any practices where I could have my dosage monitored? Is there something linked between pancreatic problems and GLP-1s? Okay, so one is that's what we do. We help with dosaging. Dosaging is so important. It's everything. The Ozempic dosing is for patients who take it who are diabetic. I'm not a believer in high doses. I'm just not a believer in it. I don't believe people need it. I believe when you turn off someone's appetite, it's dangerous. I'm not a believer in cutting people's appetite. It's a horrible thing to do to someone. It's not normal. It makes you a robot. I mean, what I'm a believer in is decreasing food noise and increasing satiety and teaching people how to eat correctly. Anyone who goes on these medications and you're never hungry, it is a big problem, and nobody's saying that. It means you're on the wrong dose and you're not being monitored. This drug is not meant and was never meant for that. And it's a big problem. And it's a hard battle to fight, but I'm going to say it again and again and again. It wasn't meant to make people walk around never being hungry. It was meant to decrease sugar and increase satiety and decrease food noise and allow people to develop new habits. I'm not talking about patients who go on it for diabetic reasons. It's a very different prescription. So you have to understand that. So pancreatic problems. So again, there are certain people that shouldn't go on it if they have a history of pancreatitis. Usually we don't put them on if you have a history of pancreatitis. and really just going up on the right dose at the right time. When you go up too quickly, when you just increase your dose because you feel like you're not feeling it and you do that by yourself, you put yourself at risk. So it's a very dangerous game when you start deciding what dose you should take based off of how you are feeling. And I don't recommend that. And if you do that, then you're putting yourself at risk, and then don't complain when you have problems. So that's my answer. Can you explain more about how these medicine help with food noise? Um, so again, that's just how I don't know the exact science behind it and why it helps with food noise, but one of the things I spoke about, it delays instant gratification, and and it it has the pause factor. The other thing it does is it increases satiety and just makes you feel full for longer. And the science behind that is really that the food doesn't pass through your GI tract as fast. And when that happens, then you're not as hungry because the food's still sitting there. And the cool part about that is that it enters your bloodstream at a slower rate, which I love, because then your glucose never spikes up as high because the food's entering at a slower rate. So it's a really cool mechanism in how it lowers sugar spike. And so that's kind of how it works. And so, yeah.
I had a patient say to me, I forgot to think about food. For the first time in my life, she said, I
Yeah.
forgot to think about food for the first time in my life. The food noise of,
So cool.
as Bracha calls it, the
Yeah.
inner argument. What should I eat? What didn't I eat? What I want to eat? What I ate instead? How much weight I'm going to lose? All of that just quiets down. The internal argument quiets down. And when she said, this is like new to me. I'm always thinking about food. I forgot to think about it.
Yeah. It's so nice. I mean, I never had food noise my entire life until I gained weight. And then I was like food obsessed for the first time ever. And it was just I was like, I never thought about food. Now I'm always thinking about food. I wake up in the morning, what should I eat today? Am I going to eat well today? Should I eat right away? Should I not? It was like horrible. And really, the food is like designed, it's in a brilliant way. It's designed in a very brilliant way, how it makes us obsessed. It's also engineered, besides the fact of whatever struggles we're going through, the food is designed to make us become obsessed with it.
I
Um,
can't believe I ate just one thing, one potato
yeah,
chip, right?
it triggers our brain. I always say if food had an FDA label on it, the same FDA label that all these medications had, let me tell you, most of you will not be eating the food you eat. Like if only the foods had the warning labels on it, but it doesn't. The horrible part is that it's packaged so nicely and it's pretending to be our friend. And so the processed food is so bad for us, but this is a separate conversation. And so the food noise is a very hard battle to fight. And like you said, your patient takes it and you don't have to think about food all day. You learn to eat when you're hungry. And you use this as a tool. And it's not, yeah.
And so I said to her, so what are you thinking about instead? This is so great. If people have more space in their head, what are they going to be thinking about? What is the next problem? But what's the next joy? I mean, let, let's add that food is pleasure and that we want people to have pleasure. It can't
Yeah.
just be about weight loss and how much do you weigh. But food is about pleasure when it's, how should we say it? When it's
The
not
part
being
of
used as a
yeah,
drug to
yeah,
cope with
yeah,
feelings.
yeah. And one of my patients, who's actually, and he spoke about this publicly, his business is food. I mean, he tries food. That's his business. And he was nervous to go on these medications because he said, I mean, this is my business. And he's lost 50 pounds. He's feeling more confident. He's so happy. He's so great. I'm like so happy that he tried it, because not that he lost weight, but because he just feels better about himself. And so he said, I still love food, but I know I don't have to have 3 plates now. I have one and that's enough.
Mhm.
So it gave him that ability to make that decision. And so I thought that was pretty nice. So yeah. I'll just answer one last question that we have because I know it's getting late. And just what about long-term side effects, those that aren't even, we don't know about them yet? And this is the question. Many experience gastroparesis, which slows down the digestive process. This goes against the recommendation of higher fiber diet to move the food along. Okay, one, long-term side effects. So again, medication's been around for many years. Ozempic's just about to go out of patent, which means it's been around for 10 years. Once that happens in 2027, the drug is going to be so readily available in the next 2 years. By that time, there's going to be so many other drugs on the market. So it's been around for a while, and there's a lot of studies. I mean, this is probably one of the most well-studied drugs out there, which is fascinating. And also so many people are on it. 1 in every 8 persons on Ozempic or GLP-1 today. Over the next few years, I believe it'll probably be close to 1 in every 5. And so we do know about long-term side effects, but I would say that most of the side effects are short-term, which means that it's about the effects that you have right away. The nausea, the vomiting, the not feeling well, gastroparesis, and all of that comes to poor management, poor dosing. It always comes down to person went up on the dose too fast. They weren't feeling it. They went up too quickly. They shouldn't have gone in the first place. They didn't understand the medication. The prescriber didn't understand the medication, or they just didn't have time to teach them. Like, you need to understand what sugar spikes are, what foods increase your sugar spikes, what foods you eat before and after. I mean, coffee was one example. Another example is you can't eat sugar on an empty stomach. You have to always have protein and fiber before you have carbs. How many people go on these drugs that don't even know that? That's like, it's like not understanding how to take drugs. So a lot of the side effects are really short term, in my opinion, of people not understanding how to go on it. It's a prescription. You should not be getting it through, I was actually on CBS News about this last week, talking about this, that people should not be going on these medications without a provider. Like, getting it online is very easy nowadays, and it's dangerous. And so if you're going to just take the easy way out and doing these drugs, then you'll get, like, the cheaper option, then you're going to get like a cheaper result. And it's really just not knowing appropriate diet, and also just not understanding the medication, like we spoke about. How is it helping you in your head? What are the different thoughts that you're having? Is it are you having a delayed instant gratification from it? Are you having the pause factor? Do you notice that you keep on going to your cabinet and you're not hungry, and then you turn around? So let's talk about that. That's something that you'd go back to Marianne and say, I've noticed that I'm not hungry anymore, but after dinner, I keep on going to the cabinet. Why do I keep doing that? It's a habit. I feel anxious. Wow, that's a beautiful time to talk about it now. And so if you're going on these medications, you're just losing weight, but you're not also talking about the habits that you have or the emotions that are happening underneath, then it's almost like a waste of this beautiful drug. You're not taking opportunity to change who you are as a person. That's how I use these drugs. That's how I see success with it. I don't use these medications as I'm dispensing medication through a pharmacy. And if that's what you're doing and what you're getting from someone, then you're not using it to, harnessing psychology to have success with it. Then you're not using it for that, and then you won't get those sort of results. So I always say the power is really you and how you use these medications. It's not so much the medications itself. It's really you. They're just guides. So that's important to know. So I know it's a lot of talking, guys, and anything you want to say to wrap up?
Let's help people sink their teeth into life and not into excess food.
Yes. Thank you. And really, really thank you for taking, for being open and curious. I think it's, as you said at the beginning, being curious about these medications. They are revolutionary. And I think through education, more and more people's lives will be changed through this medication. Weight loss is just one bucket. It helps with cardiovascular disease, inflammation, longevity, emotional eating. It's a brilliant, brilliant drug. It's really cool. And I think it's going to save many lives. So I thank you for being a part of this. And we are ivydrips.com. Anyone could just, you can Google us or give us a call. You'll get an email following up after this webinar, and you could always book a consult with one of our nurse practitioners, who are all absolutely amazing people who help people through their journey. So thank you
Okay.
so much.
So it's great to be here with you. I enjoyed it tremendously.
Thank you. Thank you. Bye-bye.